I think we can run now a video on another case on this disposable larger channel gastroscope from Ambu, which is, Pradeep, if they can go on the big screen, this is a band ligation that we have performed in a patient in the emergency room. So we have been asked to go in the emergency room for big bleeders. And when we went to the to scope the patients, there was no blood any longer, but we recognize a lot of variceal stuff there, huge. So we use this for two reasons. First, we love to have a disposable scope when we move around into the hospital. We are not in the endoscopy facility. We are in emergency room, ICU at the bedside. So it's very easy to carry on. There is no risk of bringing infected stuff across the different part of the hospital. You see, from endoscopically standpoint, it's a regular scope. You can do whatever you want. The quality of view is pretty good. So we decided to do in the emergency room band ligation. And I want to show how good it is when you perform band ligation with this big channel. Also, if you get any bleeding with this big channel, you can be prepared to suck everything out and having a very clean field. Can you please comment on it?
Yeah, no, I think the ambulatory part of it is a huge asset to take it, such a small set, take it wherever you want. And second thing is, things can go wrong any minute in these kind of situations. You can have a massive bleed. And when you have massive bleed, blood compromises your visibility. You need a massive channel. And that's what will give you confidence that you have a scope like this. You can even put an accessory down the scope, still suck all the blood and treat at the same time. So the way we manage bleed is use a water jet to see the bleeding point, suck the blood and coagulate or clip or do whatever. So the disadvantage is if you have a 2.8 millimeter channel, once you put an accessory down, that's it. You can't suck, you can't do anything. So this will just beat all those drawbacks that we have. Here you are so fortunate, there is no bleeding, and it's sucking in huge varices.
So easy,
massive, yeah.
So there are these two components, easy to carry on wherever you want, so there is no issues. And if you're in the middle of the night, you don't need to take your team, your staff, into the hospital for cleaning and disinfection of scope, which is a huge amount of time. So if you make a financial trade-off, of course, this is more expensive than a simple device. But if you consider all the time to prepare to setting the regular scope in a place outside your endoscopy facility, and plus to clean, to disinfect the scope, it's probably there will be a balance.
I 100% agree. I can remember myself being in so many situations, treating a bleeder with a standard gastroscope, suddenly facing a lot of bleed, asking for a big channel scope, double channel scope.
Move there, change the
change scope. I lost my visibility. I lose so much time. So if you allow for all these things in these situations, this will be cost effective. Because no cleaning, you don't need the staff, no need
you
of
start
changing.
A single scope you use for everything. You see, they were able to get inside the pseudocysts, the collection quite easily. They demonstrate the sucking capability is so good. And also in general, of course, this is not as good as the latest generation of disposable, non-disposable scope, reusable scope, but I think it's very good. No, you can see everything.
I agree. I think this gives you, if you choose your case right, Ale, I feel there's a place for all these scopes, and this is all about choosing your indication right. This is a perfect indication for a scope like this. I wouldn't want to use this scope in the current form for assessment of a very subtle early gastric cancer.
Okay.
But what we showed is a perfect two indications where this will make inroads.
Okay.